Hi, all. Welcome to today's webinar presentation. We've had over 600 RSVPs for this webinar series and really appreciate the many hundreds of questions that you've very kindly shared. We're going to be tackling the vast majority of them in this presentation and then pointing you to additional resources where you will be able to find the remaining answers as well. As you may know, this is part of our webinar series as far as our COVID response efforts go. So in order to find out more about our work in the COVID response in terms of policies, strategies, operations, we invite you to check out this link, werobotics.org/COVID. You'll find at that link recordings of previous webinar presentations. A few words about We Robotics, just to provide you with some context as to why we're running this presentation today. We Robotics is a local first organization. And this means that we shift power to local experts because we believe that local leadership is more important for positive social change than any techno-centric solution, which is why we are co-creating number of local knowledge hubs that help shift power to local leaders. These hubs, known as flying labs, are led entirely by local experts who we train, equip, and support as needed. And increasingly, flying labs are training each other and teaming up on joint projects. In addition, flying labs are also directly connected with key actors in government, industry, and civil society in their own countries. And today, flying labs are operational in more than 25 countries across Africa, Asia, and Latin America. And our role as We Robotics within this network is to facilitate knowledge exchange, technology transfer, and to create new leadership opportunities for local experts. And we do this through our 4 sector programs, which are directly tied to the Sustainable Development Goals. For example, we have a humanitarian program focused on a range of humanitarian projects, environmental program, development program, and our public health program that enables flying labs to run their own cargo drone projects to deliver essential medicines and also to collect patient samples. For example, in the Dominican Republic, we've worked with Pfizer to field test the use of delivery drones to deliver essential medicines to remote facilities, health facilities in the mountains of the DR. In Nepal, we worked with a number of other key partners to collect TB samples from 8 different remote health facilities and fly them back to 2 regional hospitals for rapid TB testing. This project has gone on for over 6 months now. Over in Papua New Guinea, we teamed up with a number of flying labs and the CDC to provide professional hands-on training on the use of medical cargo drones for public health. In Peru, we partnered with the Ministry of Health and a number of doctors, nurses, and health facilities in the Amazon rainforest to field test the delivery of essential medicines, patient samples, as well as diagnostic tests. And in Cameroon at the moment, we are working on a cargo drone project with the Bill and Melinda Gates Foundation and the CDC, as well as the World Health Organization, focus on delivering essential medicines, but most specifically on collecting patient samples for polio testing. Last but not least, we've also been involved in less conventional delivery projects, in this case, actually transporting and releasing Wolbachia mosquitoes. And these are special kinds of mosquitoes that help prevent the transmission of dengue fever. This has been done in Fiji over the course of 14 weeks of aerial deliveries. In addition to being involved operationally in the cargo drone space, we are also involved in providing hands-on training. And that is both in-person hands-on training, as well as then remote online training. So if this is an area of interest to you, we'd love to see you and work with you as part of this training online. In addition to operations and training, we're also involved in the policy space. For example, we've been developing a specific code of conduct for the use of cargo drones in public health, and you can learn more about that in all our cargo drone projects and trainings on our blog. Now on to the main topic for today's presentation, looking at the role of delivery drones specifically in response to the pandemic. We're going to quickly look at the regulations and questions there. We've received a number of your questions to that effect, and so we want to provide you with the latest on the topic of regulations and delivery drones in response to COVID. We'll then look at how this technology and the use cases have played out in a number of different countries around the world. And then we'll conclude with some lessons learned from the past half decade of cargo drones in public health, and then look forward to discussing all this with all of you and addressing your questions and having the opportunity to brainstorm with you during the Q&A session. On the regulations, it's been really interesting to follow the developments there. A number of civil aviation authorities have taken concrete steps to making the regulations easier to use drones in response to the pandemic. So for example, in some cases, just relaxing some restrictions around beyond visual line of sight operations, and just streamlining a number of the permissions processes. So for example, in Sri Lanka, the CAA there is going as far as crowdsourcing drone pilots in response to COVID-19. In India, we're seeing some similar steps being taken by the Ministry of Civil Aviation there on trying to find ways to enable more uses of drones in response to COVID. Before that, in the weeks before that, they tended to just delegate that to local authorities. So there's some interesting developments happening now. Ghana as well has taken some important steps to enable delivery drones specifically around patient samples. And then the FAA in the US also recognizing the fact that air traffic is a historic all-time low, that there are fewer risks than in terms of the operation of drones in these airspaces. The UK CAA has also taken some interesting steps to make beyond visual line of sight flights more easy to set up, and also have set up some air corridors as well to help facilitate the use of drones in response to the pandemic. There may very well be others. We're tracking this as quickly and comprehensively as we possibly can. If we're missing any, please do let us know at any time so that we can update our study on this, which by the way is public, and I'll provide you with a link to that public study at the end of this presentation. Okay, moving now to the actual applications of these technologies in the context of the pandemic. In Australia, Alphabet's Wing project has been facing a lot of demand for their deliveries. Important point to keep in mind here is that this setup, these services were already in place well before the pandemic. So this is not a new service. It's just that the demand for deliveries has skyrocketed due to the lockdowns. And if you're not familiar with the Wing drone, the deliveries are not done by landing the drone. It's done by cable, by lowering the payload box. So the reports that we are seeing is that there's been a doubling in terms of the increase of deliveries. What's also interesting is that originally, before the pandemic, there was not much of a focus on delivering milk and bread, but because that became a big demand for customers, Alphabet was able to bring in a new vendor to help provide that kind of delivery. So interesting to see how they have been able to respond, not just in terms of frequency, but in terms of the type of goods delivered. Over in Chile, the municipality has been using drones to deliver essential supplies to the elderly living in very remote areas. in places where, for example, it can take some 2 hours to walk to the nearest pharmacy. So that really becomes compelling in terms of deliveries. In this case, it's unclear whether the drone completely lands or they take that off the bag here, but it's certainly not a cable release. In terms of the actual types of cargo delivered, this has been a recurring question for many of you, just to get a sense of what is being delivered. Medicines, masks, hand sanitizers in this particular case. In China, we've seen a number of different companies respond to the pandemic by providing delivery services. This has been very much in highly urban areas, and companies such as JD and Antwerp are some of the ones who have been the most active. There, the drones do land, or in the case of Antwerp, they have a dedicated mini drone port in different parts of a city that the drone then lands on, and really is quite clever in terms of just enabling more safety and more automation in these deliveries. Again, the deliveries have been very urban. There have been some rural to semi-isolated islands, but primarily urban deliveries, and have been very, very short range. So we're talking just a few kilometers or miles. Patient samples have been delivered, quarantine materials as well. In Estonia, we've seen reports of one cargo drone company doing one delivery thus far from an island about 22 kilometers away to the mainland. They transported a patient sample. The flight itself over those 22 kilometers was reported to have taken about 27 minutes. And the drone does land for the actual physical delivery of the payload. And the 27 minutes is compared to what it would take to get to the mainland from the island with a ferry, which takes apparently around an hour. But that is a fixed schedule. So obviously the ferry doesn't leave the moment that you have your patient sample and are ready to board. So there are certainly going to be some delays working around established schedules. Ghana, of course, with Zipline, really getting a lot of attention in recent weeks in how they are responding to the pandemic. Of course, here in the case of Ghana and the Zipline drone, if you're not familiar, the drone doesn't land, it doesn't have a cable, it releases its payload by parachute. And Zipline has already been operational in Ghana for about a year. So the services are already set up. They have 4 dedicated drone ports. They call them fulfillment centers. So it's not new. It's already been very much operational. What is new is that since the lockdowns, they've reportedly quadrupled the delivery of vaccines. And very recently, for the first time in the company's history, have started flying patient samples. So in this case, they've flown patient samples for COVID testing. And the way that this is set up is they have dedicated vehicles, so cars and drivers and health professionals who will use these cars to go to the different rural health facilities and physically pick up the samples and bring them back to the drone port, after which they're packaged into a special red package following WHO medical standards, and from there flown to the national lab. And they don't wait to have a full payload worth of patient samples to fly to the labs for testing. They fly them right away as soon as the samples make their way to the drone ports. Now, we've learned that on average, it takes the patient samples between 20 minutes and 70 minutes to get from these rural health facilities to the drone ports. So, between half an hour and an hour, let's say. And then after they're packaged, the actual aerial delivery takes around 32 minutes. And this is reportedly saving, a lot of time in the deliveries, from hours to apparently even days. They also claim the ability to transport some 15,000 tests a day if need be, based on their 4 drone ports. Now, one open question is, how much of the patient sample deliveries are actually done via aerial delivery through zipline versus through conventional deliveries, just to get a sense of what the throughput is, could be interesting. It's also important to note that at least as of a few days ago, Ghana was facing a backlog of some 18,000 patient samples that still need to be tested. And so, of course, you can get the patient samples to the labs faster than ever before in Ghana's history. But if then they become sample 18,001 to have to get tested, you are then facing some delays there. That doesn't mean that aerial deliveries are not adding value. It's just we have to look at the whole supply chain and understand what the pain points are and what the hurdles are as well. They're not just going to be with respect to getting the samples to the labs for testing. Over in Ireland, a cargo drone company there has pivoted from delivering fast food to university students and are now engaged in delivering prescription medicines to a rural community in Ireland. This is done by cable again, so no landing. And in addition to prescription medicines, bread and milk has been delivered to this rural community. In Italy, there's been one report of this gentleman developing a cargo box that is optimized for the transportation of biohazardous samples, as well as swabs and so on. It's unclear, however, whether that has actually been used operationally in response to the COVID situation in Italy several weeks ago, when it was really at its peak. Over in Malawi, a number of drone companies and organizations have been doing and field testing drone deliveries for the past couple of years or so. There is one drone company, an Australian drone company right now, that is reportedly continuing to do deliveries to some remote islands in Lake Malawi. They were on site originally, and because of COVID had to return to Australia, but they are apparently continuing to be able to do the operations remotely. So they're actually, it's not clear how much of the operations they're doing remotely, but they're saying that the vast majority of the operations with the drone flights and so on are being actually monitored and coordinated from Australia. And so here the drone does land for the deliveries, and it's not a new service. They were field testing for a while now. And what's unclear is that whether they've actually done anything differently in response to the pandemic in terms of flight frequencies, delivery frequencies, and the type of cargo being delivered. From the colleagues I've spoken with, they don't, to the best of their knowledge, these are regular deliveries with the regular supplies that they have been delivering throughout in any event. What is interesting is that in addition to delivering, they're using their drone apparently for also imaging, for mapping. Over in Poland, there's been at least one delivery done by a drone company in collaboration with the Central Hospital in Warsaw, and this is really focused on delivering patient samples for testing. It seems like they expect to do more of this, and this was an initial demo that happened a few days ago. So it'll be interesting to follow what comes next with that particular project. South Korea is an interesting application there, not only because the drone in question that you see here is actually a hydrogen powered drone, but they also focused on delivering to islands off the mainland where pharmacies are not available. And so that's an important, I think, compelling use case. When those pharmacies are not available on those islands, that does put the local population somewhat more at risk. And so what this project did was deliver some 15,000 masks to residents across these three islands. Now, an important point to note here is that the range, delivery ranges were actually between about 2-ish kilometers and 8 kilometers. So we're not talking long range deliveries. And so whether a hydrogen drone is in fact really needed, is not entirely sure, but the point is they still did the project and completed what they set out to do. In Turkey, just an example of a hyperlocal use of a consumer drone to deliver bread. Not much more to add about this other than maybe to remind everyone that drones are flying blenders. And so grabbing drones in the way that you just saw, not advisable. In the UK, interesting developments there as part of a government initiative on the future of transport. It's something that was already put in place before the pandemic, but as a result of the pandemic, the government has really accelerated this program to trial the use of drones to begin with for deliveries to the island of Isle of Wight. There, what's interesting is that the drone itself, as you can tell here, is not your small kind of commercial cargo drone. We're talking about a gas-powered, heavy lift, long-range drone that absolutely requires a dedicated runway. From the different reports that we've seen, it supposedly can carry up to 100 kilos over 1,000 kilometers. So the trials should have started now this week, and so we're monitoring any more developments there. To begin with, the government said that the deliveries would focus on protective equipment to the hospital on the Isle of Wight. Now, keep in mind that because you need that dedicated runway, you're not necessarily landing near or at the actual hospital itself. So there's an extra step to be taken there. In the US, there's been at least one example of a hyperlocal kind of consumer-driven delivery of sandwiches literally within a 3-mile radius of a sandwich shop. And besides that, we've seen a number of corporate deliveries and companies getting involved. Again, here, Alphabet Wing has had an operational delivery service in Virginia for a good while now, so this is not new. And as a result of the lockdown, just like in Australia, they've seen a significant increase in the demand for these kind of aerial contactless deliveries. To give you examples, given that many of you are curious about what's being delivered, in this case, toilet paper, soup, pasta, pastries, medicines, and so on, and also coffee and ice cream in special packaging. And Wing is also working with CVS and FedEx to expand deliveries as well in terms of medicines and the mail and so on. Over in North Carolina, Madinet has also been operational there for a while, so not a new setup. They've been focused on short-range deliveries between hospitals and testing labs and so on. What they're proposing to do now in response to the pandemic is to deliver medicines, protective equipment, healthcare gear. Not entirely sure what they mean by healthcare gear, but we'll try and get more information on that shortly. While Zipline also is looking to deliver protective equipment. Now, this has been facilitated by the Department of Transportation of the state of North Carolina. They had a big meeting, public meeting last week to help facilitate, further uses of delivery drones in response to COVID-19. And if Zipline does move forward, this looks like it would be their first delivery service in the United States. Over in Florida, Madinet is looking to, or maybe even more than looking to, is setting up and possibly already doing deliveries to a retirement community, and specifically delivering prescription medicines to that retirement community. And we'll be updating our study on that as more information becomes available. One point to note here is that the actual aerial delivery range is well under 1 mile. So unclear what the time savings there are, especially because the medicine deliveries don't actually happen, door to door. They actually deliver the medicines nearby the retirement community, and then the medicines are put on a delivery vehicle, a truck, after which the deliveries are made to everyone's doorstep. So interesting setup, and we're keen to follow how that plays out. Also in the US, in North Dakota, Flytrex is somewhat replicating the work that they've done in Iceland, focused on delivering packages from a shopping center. And there the deliveries, the packages of food, medicines, and other essential goods. Right, so that gives you a quick overview of how cargo drones are being used across more than a dozen countries around the world. And I expect more examples to surface in coming days, weeks, and even months. In terms of lessons learned in conclusion, before we open it up to your questions, and this is just a quick reminder to feel free to use the chat to share your questions so that we can then address them and brainstorm together. But before that, lessons learned from the broader medical cargo drone space from the past half decade, and then we'll end with some quick conclusions. I think the first point to note is in the cargo drone projects that we've done now for almost half a decade, there was a lot of hype at the beginning and a lot of false advertising, and that has not necessarily gone away entirely. There's a lot of, I don't know how to count, clowns out there, drone cowboys out there who claim to be able to do all kinds of things with cargo drones. And it's really important that you ask a range of questions to really vet not only their technology, but also them as founders and employees, what their track record is as well. There have been so many different humanitarian and development organizations since 2016 that have been swindled by some of these cargo drone companies. So, don't rush into a cargo drone project without doing due diligence. Part of the problem here is also there's very little to no actual transparency. So, a lot of the projects that I've just described, from Zipline and Matternet and others around the world, there's no independent way to fact check a lot of what they report in terms of the number of flights, technical failures. You don't get any insights on that. There's also a lot of doublespeak in this space. One of my favorites is one drone company writing down in a report that their drone was lost and then not found. The drone was lost and then unfound. Took me a while to reread that and understand exactly what they're getting at. Turns out what happened was that their cargo drone crashed with the medical supplies, and they tried to find it, weren't able to, and so it's never been recovered. These companies are companies. They have a reputation that they want to safeguard, obviously, but you don't see a lot of forthcoming transparent reports on these projects, and very few independent, publicly available impact evaluations. So there's just a lot of assumptions in this space. It's worth just noting that drone corridors are not public goods. Roads are public goods. It's public infrastructure that is then accessible to individuals in a given country. Drone corridors are very restricted. You can't just access a drone corridor anytime you want or use it for anything that you want as well. So it needs to be discussed as to what kind of disincentive is the shift towards drone corridors creating for governments as far as their investment in transportation, traditional transportation infrastructure that are public goods. The digital divide is also very much driving the drone divide. And by that, what I mean is the vast majority of drone companies cargo drone companies will not operate in areas that don't have reliable 3G or 4G connectivity. And so if you're a remote community in the mountains of the Dominican Republic or the foothills of the Himalaya, and you don't have the luxury of having cell phone towers near you, you're going to be further discriminated against when cargo drone companies seek to set up shop. The delivery services will not reach you because of this digital divide. So we're seeing that compounded now in the cargo drone space. There's also a concern that perhaps remote communities are overlooked. And by that, let me just explain a bit of what I mean, just with an illustration from Zipline in Ghana. So the locations here, the 4 circles, are basically a location of Zipline's drone ports, 100-kilometer radius. The drones reportedly can fly 80 kilometers one way and then return to the drone port. But we put 100 kilometers there just to give extra margin. And so the question here is it really in the interest of Zipline to set up drone ports elsewhere? Because we're assuming that part of what their business model focuses on is the need for frequency, for very high frequency deliveries. And so they would want to then position their drone ports in areas where there is sufficient demand to warrant very high numbers of deliveries per day. And in fact, their drone ports, per what they report, are designed, and their drones are designed to do up to 600 deliveries per one report per day within that particular area. Now, the fact of the matter is that those who are most at risk, communities that are most at risk, have always been those communities that are harder to reach, the most isolated communities on the planet, for whom having a health facility around the corner is nowhere close to reality. They will then have to walk for hours and hours and hours in order to actually be able to physically access the nearest health facility. And while you could maybe argue that, in the context of this pandemic, isolated communities are potentially more protected, that unfortunately is anything but true. We're already seeing indigenous communities in most remote areas of the Amazon rainforest in Brazil, for example, being ravaged by this pandemic. And so we know from peer-reviewed medical journals and so on, and articles that most at-risk communities are the ones that are harder to reach. But these communities tend to be far more dispersed. And this is what we've seen in many of our cargo drone projects. For example, when we were doing deliveries in the Peruvian Amazon rainforest, you're talking about a pocket of 50, 100 individuals, part of a little village, a couple hundred others, maybe 20 kilometers away. So it's smaller populations and far more dispersed populations. So what does that mean in terms of the level of demand? Well, in many of these cases, you will not need more than 500 deliveries tops per year, if even that. And so does that then become a challenge for companies that have a business model that is really based on actual frequency of deliveries? And how do we then develop appropriate business models, perhaps more community-based business models that focus more on philanthropy potentially, in order to make sure that these local remote communities are actually not discriminated? There is a concern that if the government invests in these major high-frequency deliveries, are they going to want to invest any more to reach those who are really out of the way? I don't have all the answers. I do know that to service some of these communities in those locations that I'm just showing you right now, there needs to potentially be other models. And so we're doing more analysis, GIS analysis, by the way, on the Ghana Zipline project to better understand how the topography looks like in these areas, the road network, and a number of other data layers to really understand, where are we falling short in doing these kinds of deliveries. Okay, in conclusion, and then we'll take your questions. Rapid setup for new drone deliveries is the holy grail. The vast majority of examples that I've shared with you from the response to COVID are from companies or projects that have been around for a while before the pandemic. So the technology was already in place, the regulations were already approved, the pilots were already trained, the infrastructure was already there have been already numerous deliveries, there's already been awareness raising with the public, and so on. So it's not a surprise that we're not seeing completely new projects and new companies all of a sudden deliver new services in new places, new countries, and so on. And that's because, and we've learned this firsthand over the past 4 years. There's a lot of logistics that go into, and scoping that has to go into cargo drone projects. Regulations are a huge issue, and while there are some exceptions with a handful of civil aviation authorities, those exceptions are not reality for the vast majority of civil aviation authorities. And given this digital divide that I've mentioned already, fact of the matter is, in the majority world and where we work, those cargo drone technologies are not available. And the expertise does not necessarily exist either. So once again, the cards are stacked against those partners that we work with across Africa, Asia, and Latin America. And so what's obvious is that expanding existing services, delivery services, in response to COVID is far more realistic. What we do need to do is to pay attention to other disasters. Unfortunately, COVID does not have a monopoly over natural disasters. We're already seeing Category 5 cyclones hit some islands in the South Pacific. It's only a matter of time until the hurricane season starts up and we see major hurricanes and cyclones and typhoons and massive flooding and so on. So while we're all very much focused on COVID for understandable reasons, it's really important that we realize that cargo drones could also benefit other situations and disasters. So we need to also keep our eye on the horizon. And in that respect also, not only just identify long-term opportunities, but also identify key priorities for the long term. And there, I would suggest, what we should be doing, redoubling our efforts on is helping to build local capacity in the use of cargo drones for medical deliveries, ensuring that we help facilitate the knowledge exchange and the technology transfer required in order to enable more countries to have the capacity to actually carry out their own delivery services. So local companies, for example, local startups, so that when disasters do hit, you are not dependent on having foreigners parachuting in and not really understanding the landscape, the culture, the situation, the context in a country they've never worked in. If you're interested in learning a bit more about the current state of drone delivery in response to COVID, we have a 3,000-word study that is available to you at werobotics.org/COVID with some 50+ links and additional references that you can really dig into. And with that, I would love to start taking your questions. So I'm going to work with my colleague Kaya here. She's been keeping track. So let's see, we've got does recording video at any point of delivery have utility on a post-delivery basis, including captured data with a video? It's been a long day, so I'm not thinking as clearly as I would like, but I'm assuming that means, could the use of video be one way to confirm that the delivery actually has been made? That's a great question. I'm going to look into that further. I haven't, it could very well be that some of these projects do use videos to document the deliveries. Some don't for sure. They'll just use the GPS coordinates, but it's interesting. There may be some privacy implications there, but I will we'll look into that. Is flight aware data of any importance to an operation? Knowing where air traffic is for deconfliction and so on is going to be really important, especially if you're not talking about delivery services that are already routine with the flight routes already approved and the corridors already set up and so on. If you're going to work in a far more dynamic environment, that's a holy grail comment I made earlier, where you're setting up a whole new delivery service in a whole new country for the first time. If you're going to have to figure out how to actually, communicate with the air traffic control, obviously, given that you need their permissions, but to make sure that they have the ability to let you know to possibly cancel your deliveries at any given time if there's any concern with some manned aircraft coming into the area. Another question is, what are the most important questions to think about upfront as part of the due diligence process for cargo drones? That's a really great question. Frankly, for us, what we've learned now over the past almost 5 years is that the vast majority of time that humanitarian partners or development partners, public health partners, donors come to us with a project opportunity to use cargo drones for delivery, the vast majority, I would say 9 out of 10 of those project proposals ultimately don't make sense with respect to actually using a cargo drone to tackle the problem that they're looking to tackle. And so what we've learned also is that a significant amount of time and resources in a cargo drone project goes into the actual scoping and collecting relevant data, sufficient data, to better understand, whether there's a compelling reasons, plural, to actually set up a cargo drone project in a particular area. And then if so, what flight routes to prioritize, what types of cargo do you start prioritizing as well? There's so much work and time that goes into setting up a cargo drone project before you even start the first flights. I think that's something to really keep in mind. And if you start taking shortcuts, it may work out for you, but then you may end up working on a project that has very little compelling reason to actually use a cargo drone project, or has very little impact. And so doing that research is really key. And don't get me wrong, it is time intensive, it is resource intensive. And so at some point, you can't continue collecting data for 2 years. You have to make a call as to whether you think there's enough compelling reasons to do this. I'm seeing some other questions here. We're seeing a colleague here from Canada. Excited to learn about other applications. I'd love to know what's going on in Canada, by the way. That's be great to connect with you on that. So let's see if I can find a question here. One of the main barriers that we found while approaching this service for remote communities, lack of communication infrastructure. In rural areas, satellite communications is not an option. It's high latency, relatively high latency. There's also a cost involved as well. And so you're looking for solutions on how to tackle this. Oh boy, yeah. That's a challenge that we faced as well, because a lot of the projects that we do with Flying Labs on delivery drones is actually in rural areas. We're really focused on, those at-risk, very remote communities. In a way, the companies like Zipline are focusing on the aerial highways. We are focusing on the aerial back roads, right? And in those back roads, you do have a challenge around connectivity. And even if there is connectivity, in some areas we work with in hugely mountainous areas. And so you very easily do lose connectivity by going around to the other side of the mountain. Frankly, the only solutions that we've come up with is basically more antennas. That comes with a cost. And of course, if you're looking at more powerful antennas, then you potentially have not only export restrictions, but then you have import restrictions as well. Militaries may not take too well with respect to bringing some of this technology in country. So that's one challenge. In some cases, and I think this will now change. It's bound to change. But when we were starting to do this in the early days in 2016, for example, when we started, we worked in the Amazon for 2 years. But when we started in 2016, the aviation authorities actually did not require us to have telemetry over the whole course of the flight. So yeah, we had a GPS spotter, but after 10, 20 kilometers from takeoff, we wouldn't be able to control the aircraft anymore. And this was a decision that they made. They said, this is okay with us. And that's because you're flying in the middle of the Amazon rainforest. There's no air traffic. You're flying, 99% of your flight is over bush or river. And so in those cases where it's extremely low risk, that was not actually required. But I think in other countries and in other areas, you're not going to be able to get away with that in not having that kind of connectivity. So I'm afraid I don't have like an immediate, super amazing answer for you. But if you'd like to get in touch, I'm also more than happy to put you in touch with our cargo drone engineering team, who have been working on these issues for several years. And I'm sure they'd love to be able to compare notes and brainstorm together with you. I'm seeing a couple more questions here. Future webinar on the use of drones in agriculture. Sure, I can share that with my colleagues. I don't work myself on agriculture and drones, but a number of labs, flying labs, are directly involved in agriculture. Just to give you an example, in Côte d'Ivoire, West Africa, Côte d'Ivoire Flying Lab is using spraying drones for agriculture reasons. They're doing some phenomenal work there. But I'll pass on your kind request to my colleagues, and we'll let you know when we can schedule something like this. Border closure, how do you navigate the border closures due to COVID? As a UAV drone ecosystem professional, very, very good question. That's yet another reason why initiatives like Flying Labs are so important. By localizing the expertise, localizing the technology, you do not then create dependency on foreign companies and foreign actors, which, as we've seen in this case, is a big issue because now you can't deploy. I mean, the cargo drone project in Cameroon that I mentioned in brief, we had just started doing trainings with Cameroon Flying Labs when Europe started going under lockdown, and we had to basically catch the next flight back to Europe. And so things are a bit in a standstill. We're doing a bit of remote training, but it's an issue. Now we're basically waiting for the situation to improve so that we can continue the training. I don't know that there's some quick workarounds. I think this is part of this long-term priority of helping build that local expertise locally. Sora on cargo drone operations. That is not an area that I'm as familiar with. I know that my colleagues Joseph and Kaya have been in touch with folks on this. I don't know how that applies necessarily to the cargo drone space, but I'm happy to look into that and update our study accordingly. Slides for download. Yeah, the only challenge there, the question is, you're making our slides available for download. The challenge there is that we're updating this continuously. So I'm not sure how useful it will be, but let me talk to my colleagues about that. In any event, the recording will obviously be there for you. And if you do want the slides, also feel free to contact me directly and we'll see what we can do. How did you measure the cost effectiveness of drone deliveries? And have you seen any reflections? That's a great question. Cost benefit analysis. We don't know. It's hard to. It's a big question. It's part of this issue around there not being enough transparency and enough publicly available independent impact evaluations, as well as cost benefit analyses of these drone projects from pretty much everyone. What we've done in the Dominican Republic was work with a partner that did the field study, did the interviews, semi-structured interviews, the data collection, and then start developing what that cost curve would look like, number of deliveries and how that cost goes down. Now there is, and this is something we do go into quite a lot of detail in our online training on the use of cargo drones for public health. There is a cargo drone calculator that is available that a number of partners of ours have put together. It's a not so simple spreadsheet, but compared to what I've seen in supply chain modeling is relatively simple. That allows you to enter in up to a couple hundred variables and parameters to start doing this kind of cost benefit analysis. But one thing we have learned over the years is whatever you see in the literature or in these studies and these reports, there's so many built-in assumptions that if you tweak any one of them could significantly change the resulting cost curve as well. And so it frankly is more of an art than a science, because a lot of that data is not readily available. And so a lot of assumptions have to be built in. And so then you make the assumptions that make you look better, right, in terms of your donors and your partners. But that is a huge challenge. And a lot of these models as well don't capture the downstream benefits either. There's a recent study that you can look up that the CDC published earlier this year, where they did some modeling for Liberia, looking at doing routine deliveries, emergency deliveries, and hybrid deliveries with motorbikes. It's really quite strong there. And one of the interesting outcomes, and one of the interesting findings from that study is, and I'll qualify it after I share the finding, is that according to the results, drones that cost more than $30,000 US no longer become cost effective for this kind of supply chain work in the public health space. And I have to say the vast majority of commercially available cargo drones are more expensive than $30,000 US. But the caveat here is that the study was done in a very narrow focus, and so we need to not necessarily infer that to other applications. We will be adding that study, by the way, and our analysis of that study to the online training on medical cargo drones. Great questions, everyone. Thank you very much. You're still going strong here. In various cases, we've seen startups, companies forcing to have delivery drones where there are easier methods available. Yeah, I hear you. It's then actually overcomplicating the situation rather than serving to help in the situation. I couldn't agree more. I just couldn't agree more. And again, we really go into these kinds of ethical questions in our online training and really unpack them. One of the examples I share in this online training is I was doing a scoping for a cargo drone project a couple of years back. And so I'm working with local partners. We're in remote areas of this particular country, and we are brought to a river, a relatively small river. Now you'll see the video footage on the online training. And the bridge has been destroyed. It's a small bridge, but it's still a bridge that if it were still there, you could actually have a four-wheel vehicle actually go through the bridge. But it's a small river ultimately. It's barely 5, max 10 meters. And so the partners are like, here, this situation here is why we need cargo drones. And my reaction to that, and which has been my reaction to many cargo drone proposals, has been, well, why don't you just fix the bloody bridge? And I see examples from Papua New Guinea as well, in the Caribbean, in Africa, in Latin America, Central America, where frankly, just improve the transportation infrastructure. And it's not going to take, it doesn't take decades, right? Rebuilding a bridge does not take decades. You cannot use that as a counter argument. You could hire local community members to use local materials and they'd have it done in a couple of days, right? So, but the response there was really quite telling. And it was frank, and I really appreciated the fact that the partners were really frank. They said, you know what, we get it, Patrick. The problem is the donor wants to fund a cargo drone project, right? And fixing a bridge is not sexy. So there's some serious issues here that we really need to grapple with. It doesn't invalidate the value added of drones in certain, compelling cases, but there are repercussions. The more we focus on the sexy projects with delivery drones and air corridors that are not public goods, does that make governments get them off the hook from actually doing, investing in public infrastructure? So great question. What features or functions should a cargo drone manufacturer focus on to make their aircraft more useful in working with remote communities? I like that kind of question. That's right up our alley. Thank you for even asking, for even caring and thinking about remote communities. For us, it really, one of the main design features that you should prioritize is cost. We've been working in very rural areas where even, what we've done is we've repurposed the M600, the DJI Matrice 600 industrial drone into a cargo drone. It was not as straightforward as we had hoped, but after 2 years, that's a drone that's been used for hundreds and hundreds of deliveries in the Dominican Republic, in Nepal, as part of the projects that we've been involved in. And one of the reasons we embarked in repurposing that drone back in 2017 was because at least, it's an industrial drone, it's one of the most reliable, mature drones on the planet. And the price point is around $5,000 to $6,000 compared to what you're seeing commercially available now, $50,000 to $75,000 and up. So, we felt, okay, priority here is obviously reliability, but it's also price point. And even then, for some projects, that price tag was in these very rural areas. They can decide whether to spend $5,000. The municipalities can decide to spend $5,000 on testing TB samples, for example, or on a drone. And it's hard to make it's hard to say, no, let's just invest it in the drone and the drone service. And so there's a huge opportunity for startups and drone companies to focus really on very rugged, very affordable, locally affordable drones that are locally operable and locally maintainable as well. They can be fixed locally on site, so you can be self-sufficient and not required to have literally the drone shipped back to Europe in order for that to get fixed. So as much as you can do with 3D printing, and again, the point is not to create dependency, and quite the opposite. So that, I think these are really important factors. And one also feature that we've been promoting since 2016 is this idea of think about a boomerang, right? It's got to be as easy as to use as a boomerang, meaning that if the drone does land on the other side, that ultimately the local community member or local nurse, all that she or he would need to do is click, on one or two buttons. That's it, right? Make it as easy to return home as possible. And sorry, it's a long answer to your short but very good question. And again, we do go into a lot of that in our online training. But also, what we've seen is, for projects in these rural areas, you're not going to have high frequency delivery. So there's no point setting up a drone port, even a mini drone port with full-time staff. It's just not going to be cost effective with the business model that you have to work with. And so what you want to explore is the possibility of having the employees of the hospital or of the clinic, they don't have to be medical professionals. They could be the security guard, they could be the IT person, they could be whoever it is who's on the payroll of the clinic or the hospital, have that person be the main code operator. But then you have to make sure that it's super, not easy is to goes without saying, but that it's that it doesn't take more than 5 minutes of their time. Because then you have really real problems. And we've seen this from some projects in Vanuatu, where one of the recurring challenges that cargo drone companies had here was the availability of the nurses on the receiving end. The nurses had better things to do, like actually treating patients, than twiddling their thumbs waiting for a drone to land, right? So you have to be very respectful of their priorities and work around them. Now, can that go into your design priorities as well, right? Make it boring, make it something that is just so easy and quick to use that you just make it, boring. That's when you know that you've actually done something impactful. In terms of skills for pilots and maintenance, does it create local jobs or specialized resources only available in the companies? What we try and do, so all our projects, in the DR and in Nepal, in Fiji, those projects are all run by the local flying labs with local drone pilots, local drone partners. In the case of Nepal, another program that we run at We Robotics is we help accelerate, do business acceleration, business incubation. And so a couple of years back, we incubated 3 locally owned, locally managed drone businesses in Nepal. And that continue to focus on mapping services. And when we had this TB project come up in Nepal, we actually reached out to one of those drone companies that we had incubated and said, hey folks, what do you think about expanding the kinds of services that you can offer and being the first mover as a drone company in Nepal to have expertise in drone deliveries? And they jumped right on it. And so they were involved in running the vast majority of the deliveries. They trained a young 16-year-old kid who we blogged about because he's just phenomenal, to take the lead in a number of these operations as well. So the idea is to hire locally and hyper locally as much as possible, because otherwise you keep creating dependencies, right? If you have a cargo drone project that takes 7 hours by bus to get to from Kathmandu, and you depend on the drone pilots in Kathmandu, then you're creating dependency. So again, localize. Beyond the COVID scenario, are there any drone companies that are actively dealing with firefighting applications? Companies, not perhaps. I do know that many colleagues of mine in Europe and in the US who work who are firefighters in Belgium and in California, for example, they use commercially available drones like the Phantom, the Mavic with thermal sensors and so on. That is an increasingly mature use case. I don't know that there are drones that are specifically designed for firefighting from a data collection perspective. In terms of like delivering water, I haven't seen that. Obviously, water weighs a lot. There are indoor drones that are being used for search and rescue that have an exoskeleton. That is potentially an application in terms of firefighting. Happy to go into more of that if there's interest. According to you, which is better, parachuting, landing the drone? That's a fantastic question. That's a very, very good question. I think it'll depend on a number of different factors, as is sometimes the case, unfortunately, including your budget. I mean, if you're starting to do cables, there's more complexity to your drone, and that means more engineering, more moving parts, which means that there's more room, points of failure and frequency of failure that's possible. I know that Alphabet spend a significant amount of time and resources on just the hook release for their cable deliveries to make it, reliable 99.9999% of the time. So, that adds complexity. The least complexity is be careful with it. There's a reason why zipline has gone with parachuting. There is some complexity there, but the trade-off is that you limit the impact that the drone has when landing. That can actually create the wear and tear that reduces the longevity of your drones. And even if you just land, that creates other types of complexity. You need a dedicated space that is actually safe, clear of any kind of cell phone towers and trees. You then have a safety issue on the ground as well. The battery replacement, it just adds. I think it really depends on the context, the environment, the application, the partners, the budget, the time you have, because obviously the easiest will be just to land if you don't have the cable and parachute capacity. But it's a great question. I would love to see a study that does a bit more of a data-driven cost-benefit analysis on the actual delivery mechanism itself. And then lastly, thank you all for still going strong here. Lastly, what kind of parts of cargo drone will be most likely to do with 3D printing? I'm not going to be an expert on that. I would just answer maximize it. And anything that you cannot, anything that you cannot build reliably or relatively easily with 3D printers, make sure that those parts are available, the spare parts are available locally, right? If you're now bringing in specific, tools or screws or whatever it is that can only be found, it can have to be imported, that's already for me a deal breaker. Again, work with what's available locally as much as possible. And just as a quick follow-up to the firefighting question, in terms of dropping fireballs or extinguisher balls, interesting question. I have not looked into that, so I will make a note and we'll have a look. I do know that in terms of seed planting, a number of companies have been using drones to basically do this, even shooting pods of seeds into the ground, releasing bundles of seeds and so on is one application. So you'd have to look at, the first step here would be to talk to the firefighters themselves, see what they're already doing, and find out whether this is actually a problem that they need to have solved. It could very well be that in fact it's not needed. So this is maybe a good point to end on, is to, when you have different ideas in terms of how this technology could potentially help, speak to what I call the problem owners, those who are the ones who are facing a given problem, and find out whether what you're proposing is actually a solution to a problem that needs fixing. It could very well be that these firefighters already have certain tools in place that does the trick. That doesn't actually need the introduction of drone technology. And now in the event that you're proposing a drone-based solution that actually is not something they can do with existing tools, then the next step is not to deploy, but the next step is to understand what the policy and regulatory frameworks around your use of that technology are. Really understand what the implications are, maybe from a privacy perspective and so on, so that you don't face an unpleasant surprise later on. And if you really understand the regulatory and policy environment and it still looks like a good idea, then do a short field test, a short proof of concept, and include the firefighters to get their direct, honest feedback there as well. Okay, folks, thank you very, very much. This has been phenomenal. I really appreciate how engaged and how many conversations that you have helped to start here with your questions. So thank you very much. So refreshing to be able to brainstorm with so many great questions. So thank you for joining, and we will have this webinar recording available online on our blog in a few hours, at most 24 hours. So thank you very, very much. And please do follow us online follow our COVID series as well. And feel free to get in touch for possible joint projects as well, and to connect with the flying labs around the world. With that, please stay healthy, stay well, and a very good rest of your day and week to all of you.